I have been involved in implementing a health promotion program over the past 5 years, and this has been a collaboration with other researchers, 3 other sites in the US and then 1 also in Puerto Rico. And our health promotion program includes 3 components. So we focus on exercise, diet, and family time. The family time piece is largely about emphasizing family routines, like family meal times, as well as the importance of bedtime routines. And the health promotion program is a workshop series over 6 weeks. So families that are in our experimental group participate in a workshop once a week for 2 hours at a time. So at the end, they're exposed to 12 hours of the curriculum. And I'll tell you a little bit about the experimental design in a second, but first just a little bit about our family recruitment piece of it. And so we recruit our families through really a variety of ways, wherever we can find families. We've sent students, our research assistants, to schools and churches and flea markets, supermarkets, passed out flyers, told families about the program, just posted flyers in these locations. And if families are interested in participating, then they contact us and we tell them then a little bit more about the experimental design part of it, and that they will be randomly assigned either to a green group or a yellow group. That's the language that we use with the families. But for us, the green group is our experimental group. The yellow group is the control group. And we will have families initially participate in filling out when they should take a step back. So once they contact us and let us know that they're interested, then we have 1 day that will be set up to collect their measurements, and they find out on that day what group they have been randomly assigned to, if it's the green or the yellow. So once they've indicated they're interested, we do let them know that they're going to be randomly assigned to a group, and they'll find out that they come in, what group that is. So we assign each of them a number, put it into the random number generator, then we have 2 groups, and it's either they're in the green group or the yellow group. They come in, they find out which group.
And you focus just on Hispanic families. Can you explain what that choice is about?
Yeah, so the program is then culturally tailored to work specifically with Hispanic families that have, in general, have a higher risk for obesity and for the conditions that are associated with obesity. And so we have looked at the literature and what elements have been effective. And we have also worked, before we started this program, we did focus groups with our families, and we wanted to know from them, what are the barriers to exercising more, to eating healthy, and to learn what things they thought would be most effective in helping them to increase their healthy habits. And then we incorporated that in our program. And so this program, because it's being done across 5 sites, we did the focus groups at each site, and then took what we learned from the focus groups and then incorporated it into already existing program, but just expanded it a bit. And so once they come in to find out what group they're in, we take they fill out a questionnaire, a pretty lengthy questionnaire about all of their habits, exercise, diet, and the family's routines. And then they also have their measurements taken of height, weight, so we can calculate BMI, and then also their waist circumference. So we do that at the baseline to establish where they're at before they participate. And then we do that 6 weeks later when the program ends, and we do a 6-month follow-up to see if those behaviors, if anything changed. We want to see if those behaviors are sustaining, if they sustain that over that 6-month period. With our yellow group, so we did experience a little bit of participant attrition here, which was, we anticipated that it might happen, but it happened. It wasn't a huge number, but it happened more than we would have liked it to have happened, where families would come in, they wanted to participate, they found out that they were in the yellow group. They didn't want to be in the yellow group, they wanted to be in the green group because they wanted to participate in the workshop series. And so some of them decided that they just weren't going to participate from that day on, even though both groups received monetary incentives to participate. And our yellow group received all of the same materials that the green group received, but just after that 6-month follow-up. So they got everything on a CD. They didn't participate in the workshops, but they would still receive the materials. But we did have some participant attrition that happened there that ultimately our experimental group, we had more that participated in the experimental group than in the control group. And in part of that was due to families. And it's not just to that, of course, because some of the attrition happens from families that just decide that, even we had control groups that participated and then later dropped out and didn't come to the 6-week measurement time or to the 6-month one because things got busy, they just decided they didn't want to participate, kids' schedules interfered, whatever it was, there were always things that, with this type of research, that's just sort of inevitable that you're going to have some attrition. And I think overall, our retention rates were pretty high because we put certain things in place, like during the week, we would call our families and remind them about the workshop on Saturday and try to get them excited by reminding them what the topic was going to be, what food demonstration we'd be doing. We did our best to make it as engaging as possible for the kids in their classes as well as for the adults. So maybe the adults wake up and say, I don't really feel like doing it, but hopefully the kids say, we want to go, and then they show up. So
that reminds me, when you said they came in and got all these baseline and so on, who exactly is the they? If a family's participating, who in the family shows up?
So we take a whole family approach, and so the entire family is invited, siblings, mom and dad, anyone in the household. So it can be grandma, it can be extended family members. We invite the entire family to participate in the workshop, and then the parents will identify a target child that we'll be using for our analyses and collecting data on. And so that we had the data from one parent as well as one child, but the entire family is invited to participate.
I see.
And so they can be in each of the workshops.
And when they come, there's something that the parents do or the adults do, and there's some different activities that the kids do?
That's correct. So we have in each of the classes, so for each workshop, there are the 3 classes. When they first come in, they have a nutrition class. And the adults have a separate class from the children. They go over the same topic, but there's just, it's more age appropriate for the children. But we'll have in the nutrition class, one day we'll cover fruits and vegetables, another day it will be protein, we'll cover dairy, beverages, and so on. So in each of the classes, we'll do food demonstrations and did things like we made smoothies. We put vegetables in the smoothies so that, kids often, they don't mind them when they're amongst lots of different fruits. And we do similar food demonstrations in each of the classes. We did a lot of hands-on activities in the classes. After the nutrition class, the parents would come together with the kids into a family togetherness class where they'd build scrapbooks. We talk about the routines, about structuring routines. We talk about family rituals. And then our last hour, we did physical activity. And we had a instructor that created a DVD with basically these kind of cultural dances, different types of activities, a lot of fun, very passionate, and everybody, the students, all of us got involved in doing the exercise with the families. And so that was probably their favorite class because it was very active, and we'd go into the gym and everybody would.
Do you mind telling us about the measurements? What kinds of outcomes were you measuring to try to find out if your program worked?
Sure. We had not all of it, but most of it was self-report data. So we had the several nutrition questionnaires. We had physical activity questionnaires in there, a lot on family cohesion, the family routines, bedtime routines, social support. We had a very lengthy survey that in our first cycle.
Did parents answer on behalf of kids, or did kids also answer?
Kids did not answer. They didn't fill out the survey, so the parents would answer for them, for their families. And some of the questions was about the entire family, others just about the parent, him or herself. Most of our parents were mothers that filled out the questionnaires, and then the mothers would also answer for their children. And we also took height, weight, and waist circumference. And so later we calculated BMI.
Could you speculate on what happens in a self-report that you think might look different if you looked at the actual behavior? What do you think people do when they're self-reporting for them and their kids?
I think that one of them is, social desirability, that you might want to present yourself in a way that's more socially desirable. And I think especially it's a concern with after families have interacted with us for 6 weeks, that we come to all know each other better. We like each other. They are invested in the program. And then you also have to then wonder when they're filling out the survey if they might be exaggerating some of the changes because they are invested in the program. They want it to work. You just don't know. I mean, this is one of the things where I think that the observations would be very powerful, would add a different element to it. But I think that the social desirability is something that you have to do. And then there's also, of course, you remember exactly, what, you're asking them to think about the last week and what they've been eating. And so the accuracy of that, I think, can also
right.
be in question. So,
right.
So we looked at, we did a preliminary analysis. Our site and Illinois were the early implementers of the program. And so we wanted to look at what was going on with the mother's nutrition. And so we had this 24-item rate your plate questionnaire. And so they had just reported on their dietary habits. And after that, we were able to categorize them into one of three categories. One of them was that the healthiest, that you're making many healthy choices right now. Then there was the middle one where you're making some healthy choices. But the lowest one was that there are many areas for improvement in your kind of dietary habits. And we found that before the program started, with our experimental group specifically, about 20% of the mothers were in the healthiest category. 6 weeks later, so by the end of the program, that moved to more than 2/3 of the mothers. So there was around a 40% increase in the mothers that moved into that healthiest category. So pretty promising finding for this type of research. The control group, we didn't find any changes. So, and that's what we would expect and hope for. They were similar from the baseline to the 6-week follow-up.
I see.